Maybe Dr. Aysam, you could share with us the example of respiratory diseases that are caused by these environmental changes. Like what type of diseases you see in the clinic? Do you see more of the allergic rhinitis? Do you see more of the nasal congestion, more of the cough? And then we'll talk later on about the pharmacist, how they deal with that.
Yeah, actually, again, we get back to this idea that we have three main issues may affect the upper airways: the allergen, and the viruses which make disease, and the irritation. And always there is like a counteracting between them. We have a lot of patients who have already known with the allergic rhinitis, for example, which mean nasal congestion, sneezing, runny nose, nasal blockage, and this water secretion. Always I inform the patient, because you have allergy, suddenly they came to us after 2 or 3 weeks of treatment. They said, "Doctor, I start feeling some fever, some sore throat, dry cough, and body ache, fatigue." It means that the allergic symptoms predispose his nasopharynx mucosa to catch the viruses, because as you know, any allergic reaction or allergic inflammation will deal with this ICAM. The ICAM is the protein that catch the viruses in the and try to deal with it. So wherever there is inflammation reaction, it means that this ICAM and this like defensive mechanism becomes a little bit fragile.
Okay.
And that's why they catch the viruses.
Yes, puts the body more at risk of catching the virus and having a secondary infection.
Exactly.
Yeah.
So whenever there is like too much severe symptoms of allergic, it means that the chance to catch the viruses is more.
Okay.
And when we get back to this idea that Dr. Rawat said that viruses transfer fast, long distance, and the particles becomes a little bit smaller, it means that affect deeper. It means that the airway, all the airway may be affected by the viruses, not only the nasopharynx, even the throat, even the bronchus, even the lungs. And that's what we are facing like the last 2 years. A lot of severe symptoms secondary to the allergic reaction,
and
which
for
happen
for
a long period
as well.
And always I inform the patient. We try to educate the patient. We try to teach them, wait, don't do more like over management. This is very important.
Yeah.
I trust in the human being. I trust in the body that can heal itself by itself. Don't do more action that maybe your body refuse it. For example, if the patient has like allergic rhinitis symptoms, I give him the medication, then start feeling that he has a virus infection. We give him more medication, but with a moderate level. The problem, doctor, that we are seeing a lot of, I will not say that mistakes, but because the physicians becomes more aware and more cautious about the disease, they try to be more aggressive to treat like a simple virus infection.
Okay.
Till now, and that's what I want to correct from Dr. Rawat. Till now, they are afraid from the name of the virus. For example, in 2018, nobody can take care about what's the name of the virus he is getting now. Today, every like a couple patient, they visit, doctor, can you do the test and find what's the name of the virus? I don't know why.
Maybe that's a panic attack that happened after the
That's
corona.
what happened. That's what happened. I need to know what's the name of the virus. One mother of a patient visited me like a couple weeks ago. I counted how many times she mentioned that RSV virus her son is get. More than 20 times in 15 minutes, she is telling me, doctor, my son has RSV. Okay. Doctor, I'm afraid that I has RSV.
If she has RSV, yes,
what we do?
What will we do?
And who put the idea in her mind?
Yeah.
She's scared, and
so people are becoming more obsessed with the name of the virus after the COVID area. That's also
and from here I just like I want to raise like a speech. Please stop doing the virus panels. Why? If I inform the mother of this child, like 2 or 3 years old child who is admitted in the hospital for upper respiratory infection, if I told him your son has like RSV or parainfluenza or influenza or corona, what's the difference?
Yeah.
No specific medicine for a specific virus. So why you are giving them more information than they need? That's another problem we are facing. That's make more stress. I will give you another example.
Unless they, maybe doctor, they have like influenza A or influenza B.
This is the only thing that you
they
can do a test in the first
differentiate.
48 hours only.
Okay.
Because Tamiflu, as we know, or the
Works for
other
the
medication, will not be effect after 48 hours of symptoms
correct.
if you suspect that he has influenza symptoms.
Yeah. Still,
Fine.
some patients take the Tamiflu even if it's not
And that's
influenza.
not right.
Yeah, that's correct.
And the patient doing
We've
the
seen-
test for
we've seen
this
these trends.
corona at home, and always inform them, you are doing the test for the corona family, not the COVID-19. COVID-19 disappear. Corona family is a family we are living since like thousands of years. It will not disappear.
Yeah.
But the misinformation, the media, the wrong medical information, they put more stress. And again, we get back to another factors of make the infection more serious, the stress of the patient.
Yeah, because their immune system will be lower.
Exactly. It's
and they
one
are
of these
going to
4
be more
things
prone.
always I inform the patient about how you make your immune system better. No stress, eat well, sleep well,
And drink
and
enough
exercises.
water and